Right now, the MV Hondius has arrived in Tenerife, Spain. After days of being refused entry, the ship has finally docked, and what is happening next is unlike anything we have seen in a public health response in years. Here is the full update. As of today, the numbers stand at 6 confirmed cases of Andes Hantavirus, 9 suspected cases, and 3 deaths. 1 confirmed death from Hantavirus, 2 others still under investigation. The WHO Director General himself, Dr. Tedros, held a press briefing on this outbreak. He sent a team of experts directly onto the ship to assess every single passenger and crew member. WHO also shipped 2,500 diagnostic test kits from Argentina to laboratories across 5 countries to strengthen testing capacity globally. Now here is what is happening in Tenerife right now. Passengers are being evacuated by nationality. Every single passenger leaving that ship must wear full protective equipment. They are not allowed to make any contact with the local population. Buses with police escort are taking them directly from the port to the airport, a 15-minute drive, where they board flights straight to their home countries. No stops, no contact, no exceptions. For American passengers, the response is even more dramatic. The CDC has deployed a full team of epidemiologists and medical professionals to the Canary Islands. American passengers are being flown home on a U.S. government medical repatriation flight, not a commercial airline, to Offutt Air Force Base in Omaha, Nebraska. From there, they will be transported to the National Quarantine Center at the University of Nebraska. 9 U.S. residents across 6 states are currently being monitored. None are showing symptoms, but the CDC is alerting every doctor and hospital in the country to watch for hantavirus symptoms in patients who may have been on or near the ship. Now let us talk about where this virus actually came from. The Argentine Health Ministry has published a full report tracking the movements of the index case, the Dutch man who was the first to fall ill. He and his wife spent 4 months traveling across Chile, Uruguay, and Argentina, a bird-watching trip that took them through regions where the Andes virus is endemic. They crossed the border between Argentina and Chile multiple times. They visited Neuquén, a known hantavirus zone. They visited Misiones in northeastern Argentina, another known endemic area. They returned to Ushuaia just 4 days before boarding the ship on April 1st. Argentine authorities are now physically trapping and testing rodents along the entire route the couple traveled. Scientists believe they were exposed during a bird-watching excursion that brought them near a landfill, where rodents carrying the Andes virus were present. 1 exposure, 1 couple, and it ended up on a cruise ship with passengers from 23 countries. Here is what makes this Argentina connection even more alarming. Argentina reported 101 hantavirus infections since June 2025, roughly double the number recorded in the same period the previous year. The virus was already surging in Argentina before any of this happened. Nobody was talking about it. Now the whole world is paying attention. The WHO has been clear, this is not COVID. The Andes virus does not spread as easily as a respiratory virus. The risk to the general public remains low. Experts believe this outbreak will be contained. But here is what TrackHanta wants you to understand. This outbreak was identified because people got severely sick and died on a ship in the middle of the ocean with nowhere to go. If this had happened on land, in a city, at a hotel, at a bird-watching camp in Argentina, it could have spread for weeks before anyone noticed. The early warning systems worked this time. Barely. We track this so you stay informed. Subscribe to TrackHanta. Hit the bell. Share this with someone who needs to see it. Stay alert. Stay informed. We will see you tomorrow with the next update.